Good morning. My name is Deborah Hawkins, and I'm a Virginia licensed marriage and family therapist. And I want to talk about our counseling standards of practice. Say that a counselor shall be, quote, able to justify all services rendered to clients as necessary and appropriate for diagnostic and therapeutic purposes. The APA determined in 1973, which is 45 years ago, that homosexuality is not to be classified as a mental disorder. Therefore, a professional counselor cannot diagnose nor treat homosexuality as a mental disorder. But homophobic attitudes have been institutionalized in nearly every aspect of our society, including social and religious circles. A strong desire to be like others and accepted may cause LGBTQ individuals and or their families to want to identify with the dominant culture or the religious community, free from discrimination and social devaluation. As a group, LGBTQ children experience unique stressors and developmental challenges. They develop depression, anxiety, substance abuse, and suicidality at higher rates than those in the general population. So there's an important role for counseling with this population dealing with homophobic stigma. But professional counselors must practice to an accepted standard of care. We're encouraged to use evidence-based treatments, peer-reviewed treatments that rely on methods proven to be safe and effective, with a goal of improving the quality of life, relieving symptoms, and boosting a sense of well-being. Evidence-based treatments for children, for example, might be cognitive behavioral therapy, family therapy, play therapies. Conversion therapy is not evidence-based. It isn't really therapy at all. It's total, unadulterated quackery, a painful process of humiliation and degradation that only brings shame, self-loathing, and despair. While contemporary versions are less shocking and extreme than those of the past, they're equally devoid of scientific validity and pose serious dangers, especially to minors. Would we allow a physician to similarly fraudulent treatment based on utterly debunked science? For example, would we support treating cancer by a regime of coffee enemas and vitamins? There's no evidence that efforts to alter sexual orientation or gender identity by CT talk therapy are effective, beneficial, or necessary. And since CT interventions carry the risk of significant harm, they're contraindicated. Additionally, our standards say that counselors, quote, bounds of their competence based on their education, training, supervised experience, and appropriate professional experience. There's no Virginia accredited college, university, or continuing ed course that teaches or provides intern supervision on conversion therapy. Therefore, a counselor cannot legitimately be competent in CT. To summarize, conversion therapy is 1, unethical as it doesn't meet a standard of care. 2, no counselor could have received accredited training. And 3, it's a mental, harmful quackery. Government cannot free people from stigma. However, you can combat stigma by banning the use of CT by licensed professionals. Thank you.